Hello friends, today we are going to discuss about the most important topics of gynecology for your upcoming NEET and INICET examination. I will just going to the highlights, the most important topics about the gynecology, and it is totally 11 topics. I have gone through this, and this is the firstly I will go through about the amenorrhea topic. And this in this case of amenorrhea, you have to know about the two things, like in case of primary amenorrhea and the secondary amenorrhea. In case of primary amenorrhea, there is a Mullerian agenesis and gonadal Disgenesis. So this is very important topic for your exam, and this is I have already found, I think, total 4 questions in the previous year INICET exam. So this is about the gonadal Disgenesis, Mullerian agenesis. In case of gonadal Disgenesis, gonad about the ovary, dis no, so no ovary. So uterus is present. So Mullerian agenesis should be opposite. It is ovary present, uterus absent. In case of gonadal Disgenesis, there is 3 disease. This is the Turner syndrome, that is 45XO, small height due to socks absence. Next is the pure gonadal Disgenesis. In case of Turner, you have to know also there is an streak ovaries, one of the favorite topic, 46XY, and due to SRY mutation in SRY gene. Next is the mixed gonadal Disgenesis, and this is mixing of Turner and pure, like 45XO plus 46XY. Okay, so you have to also know what is the various treatment and what is about its hormonal status. So there is increase in LH, increase in FSH, so hypergonadotropic hypogonadism. Okay, about you have to also know about there is how it is treated. So as there is no ovary, so you have to need ovary, so donor ovum, but as uterus present, so no surrogacy is needed, no need surrogacy. Okay, in case of Mullerian agenesis, the disease is Rokitansky syndrome, or you also know about the MRKH syndrome, and here is the ovary present and uterus absent, so it is Rokitansky syndrome. So it is very simple that there should be no need of donor ovum, but uterus absent, so uterus transplantation you have to done. But also there you have to, during this topic, you have to also know about the Kallmann syndrome, imperforate hymen. During Rokitansky syndrome, please go through about the androgen insensitivity syndrome. Okay, so this is about the amenorrhea. Also you have time, please go through secondary amenorrhea topic about Sheehan syndrome and everything, whatever left, so go through. Next is the PCOD, polycystic ovary disease. So firstly about the Rotterdam criteria. This is 3 things is present. Firstly about the hyperandrogenism, amenorrhea. Third is the USG criteria, that is more than 12 follicles, more than equal to 10 cc, 2 to 9 millimeter in size. But you have to remember, in case of Rotterdam criteria, there should be minimum 2 out of these 3. So if there is USG criteria is absent, it also included in PCOD. Okay, this is important. Next is management, and you have also know about this is an hormonal in case of management, the weight reduction is the main motto, and also about read about the other things, okay, in management. Next is the hormone assessment. This I think very important. and this is there is an increase in LH, decrease in FSH, increase in estrogen, decrease in progesterone. And I just simply remember for this, I read it like that: if there is increased LH, this leading to negative feedback leading to decreased progesterone. In case of FSH, there is similar negative feedback leading to increased estrogen. So it is very, very simple. Next is the ovarian hyperstimulation syndrome, and I will especially tell about the risk factors. But before that, I will tell about the USG things like PCOD, and in case of OHSS. PCOD, there is small like cysts in necklace pattern, but in case of OHSS, there is a very large follicle, and it is easily should be identifiable. And you can look at 2 to 9 millimeter size, because OHSS is a very, very large follicular cysts. So easily you can diagnose these things. And next is about the risk factors. It is the injection FSH. In case of cause, it is injection HCG. And you have to know about the what is the prevention. So this is also very important. You have in case of prevention, there is total 4 to 5 points, but I will especially important on the prevention that you have to remember. Please delay injection HCG, stop FSH, and add injection GnRH. Okay, GnRH antagonist. Also, there should be in cryopreservation and various things you have to go for monitoring. Also, bromocriptine. So cryopreservation. So this is also in case of prevention. Go through this topic, and this is very, very important. Next is the thing is infertility. In ovarian reserve, in previous year INICET July session 2021, there is already came what is the best ovarian reserve, and it is serum AMH. Okay, but there is other thing like serum FSH, serum NMN-B, plus go through this the values before your exam. Okay, and this is a very important topic. Next is about the HSG. Okay, histosalpingography is very, very important. Firstly, you have to know in case of HSG what about the various like didelphus, bicoronate, septate, uterus. Okay, so about the HSG you have to diagnose this. And in case of HSG, how it is done, what is the instrument used? The instrument used for HSG is Wilkinson cannula. Okay, and the dye is urographin dye. Okay, so this is important for your exam. Next is genital tuberculosis. I will especially tell about the aspirants that tuberculosis is a hot favorite topic for especially NEET peoples. And in case of medicine, in case of surgery, everywhere, in case of chest medicine, and in case even gynae ops, there you have to read this topic very, very seriously. Tuberculosis, especially the what are the guideline changes in tuberculosis management. Please, this is very, very important for our upcoming examination. Tuberculosis, I will especially tell about the various present HSG findings. That is very, very important. That is the male factor is also very, very important topic. In a genetic, there is a tobacco pouch appearance. Please go through this, and lead pipe appearance. In male factor, it is very, very important. There is total 10 to 11 points, and this should be in your LMR topics. And already one question in previous year NEET papers. And male factors, and obviously azoospermia, this is also very, very important. And in case of azoospermia, how will you hormonally assess the things of azoospermia? So this is very, very important for your exam. Next is the and in case of hormonal assessment, you have to know about the various things like causes, and also treatment is very, very important for this. Next is about the endometriosis. In case of endometriosis, the presentation, you have to know dysmenorrhea is the main chief complaint. Dysmenorrhea, then chronic pelvic pain, next dyspareunia. Okay, so this is the presentation. And also you have to know about the managements. This is also very important, how it is treated. whole guideline you have to read it. Next is the adenomyces image and fibroid. So this is, I will just emphasize a short diagram basis for your exam, how it is look like. In case of adenomyces, suppose this is an uterus, and adenomyces is a symmetrical enlargement of the चारों तरफ बढ़ रहा है, okay, and there is some various hemorrhages, spots of hemorrhages is present in the uterus, okay. So this is how it is look like, okay. This is the thing like that, okay. This is how the uterus in adenomyces look like. Next is the fibroid. In case of fibroid, there is an asymmetric enlargement of the uterus, and there is no such as any hemorrhages. So this is like that. This is the thing that uterus is look like, okay. So this should be your favorite image based question. How will you differentiate between adenomyces and fibroid? And also read the treatment. Also there is a various types like submucosal, subserosal, and this is how will you diagnose. And also treatment, in each treatment you have to know how it is treated in various age groups, in which you give myomectomy, in which you give for medical management. So this is important. Next is I will especially tell about the cervical carcinoma, and this is very hot favorite topic for exam. And Pap smearing is very important. Already a previous year question, what is the 95% ethanol is used in case of fixatives. And you have to also know about the endocervical brush and or spatula, how where the various specimens is collected. And also you have to read about the various things in case of how Pap smear it is look like, the cervical histology, cervical and you have to also know about the cervix vaccination, Gardasil, in which age group it is given, in how different duration it should be given. Everything is very important. And what is about 6, 11, 16, 18. And you also know about the staging. This is very important. 1A1, 1A2, 1B1, 1B2, 1B3, 2, 3, 4, and in which cases you have to go for tracheotomy, in which is type 1 hysterectomy, type 2 hysterectomy, type 3 hysterectomy. Everything is very important. And I will especially tell about the point A and point B in case of chemoradiation therapy. And you have to know about the in which areas the chemoradiation is given. So point A in case of chemotherapy, and point B is very important for location wise. So go through this topic, okay. This is about the next is vulval carcinoma. And just there is already one initiate question I have found, and only grading I think sufficient, 4 to 5 lines, and just according to the management is sufficient. And you don't go to very deep, and just go through the basics. Next is a topic like ovarian carcinoma, and I will especially tell this is in case of surgery. There is testicular carcinoma. Also in case of gynae there is ovarian carcinoma. And you have to, it is a very scoring topic, and very simple question is asked. In case of ovarian carcinoma you have to know about the what is surface epithelial surface epithelial tumor, germ cell tumor, sex cord tumors. In case of germ cell tumor, what is the age group, like it is in any age groups, but present as abdominal pain and acute pain. And in case of surface epithelial tumor it is postmenopausal. In case of serous, mucinous, how it is which is most common, and the histology wise. So it is very important. What is CA1 CEA, what is beta HCG, what is AFP, in which case it is increased, what is G germinoma, in everything. In ovarian carcinoma, this is a hot and favorite topic for your upcoming any exam. So this should be your LMR topic, I think, in your preparation. Next is about the prolapse. In case of prolapse, this is very important about the how uterus is suspended. It is very important. And I will especially tell about the how will you differentiate between uterine inversion and prolapse. and there is already uterine inversion question, I think already came in INICET July 2021 paper. So this is like the, in case of uterine inversion, it is come through the introitus, and it is totally wholly covered, so you cannot find anything. So this is like that in case of uterine inversion. So this is something, the something is coming out vagina or like introitus, and you can't find anything. It is like a solid ball come. But when you talk about the uterine prolapse, there is this is the, suppose the introitus, and this is the things coming out, but there you should find the a small hole like things, and this is the easiest way to differentiate between uterine prolapse and uterine inversion. Okay, so go through these prolapse topics, and I think various age groups in case of pregnant women, in case of early age group, in case of more than 60 age group, you have to know what is the protocol of management of various stages. And about this topic, it is very important, what is further operation, everything. And in this topic, you have time, please go through the hysterectomy operation, how it is thing. This is also very important topic, so please go through this topic. And also next is the contraceptive topic. I will especially talk, this is a overlapping topic of our community medicine. So various brands of like condoms, like Antara, like Saheli, Chaya, Saint Proman, and various, these you have to read from both the topics, I think in gynae and community medicine, and also the various surgeries. And it's and very hot and favorite topics. Minimum 2 and 3 questions are already come, and so please go through this contraceptive topic. Next is, and obviously I think nextly I will talk about the difference in bacterial vaginosis, candidiasis, and trichomonas vaginalis. So please make a three-way table, and you have to know about the various Nugent scoring in case of bacterial vaginosis, Amsel's criteria, and also you have to know it is a what is the pH, what is the color change, what is the treatment, and what is the in which partners are treated. So please go through this topic, and I will especially talk about the kits. There is total 7 kits for sexual transmitted disease. So this is the way you have to be prepared for your exam, and various kits are already I think one kit question already came in July session of INICET 2021. So this is also one of what of the hot and favorite topics. Okay, so this is the topics. I think gynecology is the most important, everything is important, but I am highlighted the one of the most important that is repeatedly asked, and on the basis of various exam I have given, and also in case of various previous year papers. And but if you tell me the most important, then I will especially about the primary amenorrhea, and obviously next is the male factors for infertility. Next is the cervical carcinoma, this is I think the most, and obviously ovarian carcinoma, this ovarian carcinoma, and this I will highlight it, and also the contraceptive topic. Okay, also the contraceptive topic, I think this is the 5 topics you can't skip a single line. I guess this is the most hot topics for this year, but remaining I think you have to cover this topic by your heart. Everything is important, and I have highlighted the most important. And if you have any doubts in obstetrics, I have already uploaded it. Please see this video, and if you like this video, please share the video.